Welcome to our city. Joining me today to discuss the YMCA Early Learning Readiness Program is Elaine McCahey, and she is the Director of Association Initiatives. Welcome, Elaine. How are you?
Thank you so much for inviting me. Good.
My pleasure. Now, you weren't born in Elizabeth.
No, I wasn't born in Elizabeth. I was born in Brooklyn, New York.
Brooklyn.
And now, by way of Staten Island, made my way to New Jersey.
Okay, I'm trying to make you talk more, see if I get that Brooklyn accent out of you.
Yes, that would be. I try to get that out of my, I guess, my speech pattern.
Okay, and now you're working with the YMCA.
Yes, the YMCA of Eastern Union County. I've been working for this Y for the past 8 years. So I've been working for the Y a lot longer than that, but we'll just go the last 8 years.
Now, we've had Ruben on the show and a few others, and just driving by the Y and everything, you see a lot going on.
Absolutely.
Tell us a little bit about what's happening at the Y.
Well, the Elizabeth branch has been part of the Elizabeth community since the early 1900s. So there have been several renovations along the way, but we've recently been under renovation with our Elizabeth branch. We have 4 branches, though, as part of our YMCA, 2 in Union, 1 in Rahway, and 1 in Elizabeth, and we serve like 13,000 members across Union County. So there's been a lot of changes going on with the Y recently, not just us, but our YUSA, with YMCAs across the country. So this early learning readiness program and many of the other things we're doing are all part of this developing programs that communities need in order to impact people's lives. So that's what we're trying to do with our Elizabeth branch and our Y.
Now, when we talk about the YMCA, historically, can you share with us some of this history of the Y?
Sure. Well, our YMCA, as I said, has been in Elizabeth since 1900 with the building in 27, 26 was when the building came. Then it started to expand into other areas, and that's how it went to 5 Points with a small building, and now it has 2 buildings and 5 Points, and then it became part with Rahway back in the 1990s. So it's grown throughout the community, but we're part of YUSA, which is part of 2,600 YMCAs across the country. So it's a large organization. In New Jersey, there are 46 or so YMCAs, so we're one of about 46.
Okay. Now, if you had to, could you highlight some of the new and exciting programs that are happening with the Y today?
Absolutely. As we mentioned, the Early Learning Readiness Program is one of our programs which we're just going to launch next week. And that's part of the YMCA's program to reduce the education gap that we found, especially in children that are not going to straight child care programs, that when they enter school, there's a gap. That's one of them. We also have been trying recently with our YMCA's diabetes prevention program to help people and to stop the tide of diabetes that's going across the country. Our Healthy You program is a program that was offering school-age child care and still is programs to at least make sure they have 30 minutes of activity a day and healthy nutrition, and now we're expanding that into our child care programs. And those are all, both diabetes prevention and Healthy You are all part of our sort of trying to reduce obesity. That's been part of our drive over the last few years, along with the 7th grade initiative, which offers all 7th graders within our service area a free membership for a year so that they can begin to develop their own health and well-being. So those are our overall strategic initiatives for our association.
Now, when you mention all these programs, exactly who are you impacting? How do families get involved in the Early Learning Readiness Program? Well,
the Early Learning Readiness Program is beginning next week. It's for informal caregivers and the children, anywhere from infant until preschool, 5 years old. People can just come in and register for the program. It's completely free to the community. We want to offer this so that anyone in need can come in and take this program. So we've been contacting local churches, we've been contacting local organizations, sending out the information. So if they have families in need, we even talked to the Board of Ed here in Elizabeth, families in need, we want them to tell them about this program and let them come in and register. The program will be either Monday and Wednesday or Tuesday and Thursday from 10 to 12 at our association offices or across the street from our YMCA at 135 Madison Avenue. They can just come in next week or any time over the next 40 weeks and register for this class. We would like the caregiver and the children to be involved in this program.
Now, earlier you talked about the YMCA's diabetes prevention program. Can you tell us more about this program?
Absolutely. Well, we all know this. We've seen a rise in diabetes over the last 10 to 12 years. Along with the rise in obesity has come a rise in diabetes, where over 25 million people have diabetes already in this country. But the underlying real bigger problem is that 79 million people are probably pre-diabetic or at risk of developing diabetes. So because of that, the Y was trying to find a way to combat diabetes by actually providing intervention in diabetes prevention. And they work together with the CDC, and I hate to use things, I can't remember what CDC stands for, and the National Health Authority, I will remember. And they developed this program over 10 years. And they found that having an intervention program with lifestyle change, small changes for lifestyle changes, has made an impact on people developing diabetes. And if you can lose 7% weight loss and you can increase your activity to 150 minutes per week, then you can reduce your risk of developing type 2 diabetes. So we have started this program in our community, and we have tried to reach out to people that might be in that category of developing diabetes. And that would be people that are obese, that they might have a body mass index or a BMI of over 25, and you can figure that out by going to your doctor or going to a screening of some kind, and you find out where your BMI is. Right. If you're over 25, then you begin to understand that you might be at risk for developing diabetes. If you have had high blood pressure, if you have a family history of diabetes, if you've been inactive for years, right. Any of those things could be at risk. And this program is 16 weeks, but really we provide support for a year. Okay. So it's 16 weeks, and that's when people come in together as a group. They have a curriculum that helps them look at what they're eating and their activity, and helps them talk about what are some of the struggles they're having. And as a group, they try and give different small steps to make changes. Right. So they feel supported by the group, they feel supported by the coach of the program, and they kind of have a way to make these changes and see them have an effect in the way they feel, in the way that they can do more things, in the way they can be more. Just last week I was at a group, and the woman was talking about how just being in this program for 8 weeks, she was already feeling more active, and like she had more energy to help her nephew move, which she would never have done beforehand, help anybody move. And she was the active one of the group that day, instead of at other times when she wasn't.
Now, the program for diabetes that we're talking about, is it set up, or the curriculum set up for the entire family, and do they go through it at the same time?
They don't go through at the same time. People can. We've had husbands and wives register for the program. We've had sisters register for the program. So we've had people that come in together. But what does happen is, if the coach of the class, she'll have one-on-one sessions outside the class with the participants to say, okay, what's going on that is a stumbling block? What's happening? And if something does come out that it's a family member or some dynamic that's going on, they'll talk about that, and she'll invite a family member into a one-on-one with the person. So we want to engage the entire family, but we start with the participant that wants to be there first, and then we can expand out from there.
And early learning readiness, the specifics on that?
But the specifics are, it's called Caring and Learning for Me, is the program name. It's called Caring and Learning for Me. The specifics are that we have 2 classes. One's going to be straight in English, and one's going to be bilingual Hispanic. We have seen that, again, with the rise of Hispanic families moving into the community and the need for bilingual programming and bilingual staff, that we're also going to offer this within this program. People can just come on Monday and Wednesday, or Tuesday and Thursday. Monday and Wednesday is the English class, Tuesday and Thursday is the bilingual Spanish class. People can come, register that day. There's no fee. They really need to commit to coming, because the idea is, if we can help people through this 40 weeks and provide the caregiver and the child this program, that their success rate in school will go up when the children are ready for school. And really, we're gearing this program to the caregiver. Although we're working with both, The program is for the caregiver. We're going to provide resources. We're going to bring in people that might do workshops, whether from WIC, if the parent needs support in some kind of nutrition or whatever, we'll bring in that kind of support, or if they need support in how to plan, healthier family meals, or how to provide better learning within the home. We want to provide different resources for the caregiver. We'll work with the library, borrow books, and have a lending library so they can read to the children at home and provide that same thing that they're learning in the class at home. The goal is that they take what they learn in the class and they take that home with them, and they continue that work.
Right.
We know that 4 hours a week isn't enough, but perhaps we can work with the caregiver who can then work with the child at home, and that's the goal.
Right.
The goal is to also know what the school would like to see the kids come in with, and then make sure we're providing that so that they're ready when they go to school.
Okay. Now, who's eligible for this?
Anyone is eligible for the program that has a young child, anywhere infant age up until 5 years old. They live in the community. They're eligible for the program. There's no other eligibility requirements. They don't have to be a member. They don't have to do it. They just have to be part of the community and in need of this program. It's basically targeted for families that might be vulnerable, new to the community, new immigrants, families that maybe economically can't afford childcare, those kind of things that might be happening. Right. Working parents, though, that have informal caregivers, maybe a friend, a relative, a grandparent. I heard people call me today. My mother-in-law watches my child. Can they come? Yeah, anyone in that kind of situation. But we've also had moms and dads that want to come. Someone said the dad's gonna, my husband's going to bring them. So it's really open to anyone as long as there's a caregiver and a child. And then they're eligible to come to the program.
Okay, that sounds a great program, and we're gonna take a break and come back and talk about it much more.
Thanks.
All right.
Thank you so much.
Good. We'll be back with the second half of Our City after these words. Thank you. Welcome back to the second half of Our City, where I'm joined with Elaine McCahey from the YMCA Early Learning Readiness Program, and we're discussing a lot of the great things taking place at the Elizabeth YMCA. The programs we talked about as far as diabetes and the readiness, what would someone do if they were interested in the programs and they want to register? How would they go about that?
Okay, well, they can either call me, and my number is 908-249-4806. They can go on our website, which is ymcaeuc.org, and get information where they could get our address, phone number. As far as early learning readiness, really they just have to come. If they come that day on either Monday, Tuesday, Wednesday, Thursday, we'll get them into the program and get them into the class 10 to 12. We're going to be there for the next 40 weeks at least.
Right.
So they can come in any of those days. As far as the diabetes prevention program, they need to contact me, because we check eligibility as far as their risk factors and what their physical where they're at right now. If they are at risk for prediabetes, either they've been diagnosed as pre-diabetic from their doctor, or they have these risk factors, which are the BMI, over 25, inactivity, high blood pressure, or had someone in their family that already has diabetes. So if they're interested in the prediabetes, they really need to contact me. Okay.
And in addition to the YMCA, are there any other partners or anyone else supporting the prevention program?
Yes, the diabetes prevention, like I said, the CDC is the Center for Disease Control, work with our YUSA office to begin to set up the program. So we received a grant from YUSA, which they received from the CDC as well as United Healthcare, and that's how we began the program. In Elizabeth, though, we've had tremendous support from the Elizabeth community. We received a grant from the Elizabethtown Healthcare Foundation so that we could spread the word and get this information out. So over the past year, we've had many screenings for prediabetes. In fact, in November is Diabetes Prevention Month. So I'm working with Trinitas Hospital, and they're going to come and do a workshop and a screening. So we'll have more information on that on our website for November. But we've worked with Trinitas Hospital. We've also worked with Overlook Medical Center and Robert Wood Johnson University Hospital in Rahway. So we've had tremendous support from all the communities we serve for the diabetes prevention. For early learning readiness, again, we received a grant from YUSA to begin this program, and we are looking for partners that might want to partner and help either spread the word or might be have some funding or ways that some resources that could be used for the program. Healthy food. We're looking for donations of healthy food that we could have for snack or places that people could go. So we're open to working with anyone in the community in order to further this program.
Okay. Now, as we talk about the YMCA initiatives and partnership, tell us about the new Tell us a bit about the new program you have that is offered with the newly renovated Elizabeth Public Library.
Well, the Elizabeth Y is under renovation right now, and they've had many partners for this renovation. One of them being Mayor Bolwidge and the City of Elizabeth that's helped with our housing component. Both Susan Ucci and Martha Estrada, they've all been integral in helping with the renovation program for our housing. We have several housing programs, but the one that's in our Elizabeth branch itself is the men's dorm program. And that, since the renovation, not only will all the rooms and amenities be renovated, they've been able to expand the amount of rooms that we have to, I believe, something like 76 or 76 for men. And not only do we provide the room, but we also provide services so that the men that come in might be able to find a job or find a better job or find resources within the community or do something to better themselves through the workshops and programs that they run, so that they become more they can become viable in parts of the community in both working and for themselves, and so that the residents becomes a stopover to something better for themselves. So with all of the support that we've had, these rooms and the Elizabeth branch is able to serve more people, is able to have a greater impact, and the men that come have a renovated, great place to live while they're going through some transition in their lives. So that's how we impact our lives with our housing program in Elizabeth. And that's only one part. We also have housing and programs for women and their children, and a shelter for women that have just got out of drug rehab and need a place to restart. So that it's one part of a growing program to serve the Elizabeth community.
Okay. Now, you touched on a few things, but tell the audience what they may find to support health and well-being.
Okay, well, again, with the renovation, what we've tried to do over the past several years is really expand our health and well-being. People that are already active and come to the gym, we all love them, and they're the greatest part of of what we do. But we want to serve the people that struggle, and this isn't easy to go work out every day, and if they don't know what to do. So in order to do that, we wanted to renovate our facility in Elizabeth to be able to do that, and I'll talk a little bit that, but more importantly, we wanted to train our staff on how to be welcoming, train our staff and how to work and ask people and be supportive for them to make these small changes, what they need to make change. The equipment and facility is great, and the new facility is going to be wonderful with a brand new fitness center with all new equipment that's very easy to use and will allow people the opportunity to get started, but also new program spaces for classes and new places and rooms so that people can sit down and have a health assessment, can sit down and have an interview, have an orientation on what to do. So how many people walk into a gym and have absolutely no idea what to do and get turned off, whereas we think that's the more important piece, is that, yes, here is what we have and it's beautiful, but what we offer from our staffing point and what the support we want to give is what's going to keep people coming back day after day. When you don't want to work out, that's what we want people to do, is think about, we need to come in and we need to, and do this. And they have a face to a name, and they'll know someone's going to miss them, so that they're kind of feel a little obligation to coming in and working out. And that's what we're trying to help people do, take those small steps to make change.
Well, when you start talking about people who don't want to work out, I'm taking offense to that.
I don't mean it that way. I want to welcome you back too. Come in and see us so that...
I will.
Yeah, absolutely.
When you talk about the dorm program, who are you serving in the dorm program?
They're serving men in the dorm program, basically men that have either short-term needs for some type of housing, and there's referrals that go on with different agencies in Elizabeth that refer men to the program, so that they have clients that need a place to stay or need somewhere to go, and they refer them. So It's basically men in need of either temporary type of housing or something to get them back on their feet, and they find out about the Elizabeth Branch Inn, and we come in and provide that support for them. So it's kind of like everyone in the community working together to provide this. I know they also provide support in the winter when it gets really cold, a place for people to come in and have a place to stay overnight. So there's all different services that we run.
Okay. In addition to the renovations to the dorm rooms, we understand there's also been extensive renovations to the health and well-being areas. Can you elaborate on what's happening there?
Absolutely. All of our health and well-being used to be downstairs. Well, we're bringing that all upstairs to our first floor, so it's more welcoming. We have one side of the Y has all new equipment with lifestyle equipment. It's going to have a beginner weight training circuit. It has cardio equipment, treadmills, recumbent bikes, ellipticals, as well as heavier weight equipment. So people can either, it's sort of like a journey circuit. So if you start out as a beginner, there's a journey circuit for you, and as you advance, you can advance to one of the more engaging circuits, but the cardio equipment is there for everybody. And we'll let people know how to run it, how to turn it on, where do you start from, because you don't want to just get on a piece of equipment and have no idea what to do. Also, on the other side of the building, we've renovated the whole left side of the building for a program space, because we found that women in particular love classes. And so Zumba and Latin dance and yoga and all those kind of things will be right there on the first floor. We're also going to have facility for babysitting or child watch, which we haven't had in years. So people will be able to come in and have a safe place for their children while they work out. And there'll be classes for nutrition workshops and meditation workshops and how do I reduce stress work, you know, whatever the community needs, and that'll be part of it, is asking our members. So we have this space now. What would benefit you for your own health and well-being? So the renovation, and you can't, it's hard to tell from the outside, people willing to come in, so I invite everybody in to see this, because as I said, it is a historical building. So we renovated within keeping the history and the ambiance of the room, of the Y, but have upgraded it such a great deal so that people will feel more comfortable, and their locker rooms are going to be renovated, and all the spaces where our members can come in and feel comfortable and feel welcome, and that's the idea of the renovation. Okay.
To get additional information, they can contact you where and how?
Okay, they can still contact me. I would say 908-249-4806. Visit our website, ymcaeuc.org. The Elizabeth Branch has its own section on that website, and they can just get more information, and they'll have a whole list of people to contact from there. But I would say if they find me, that would be, I can direct them anywhere.
Well, thank you very much, Elaine.
Okay, thank you.
Once again, we want everyone to join us on Facebook, City of Elizabeth NJ. And again, we thank you for tuning in for this segment of Our City. Have a great week. Thank you.